Hey guys, okay, now we're going to start on chapter 9, page 283, the pediatric examination. Again, as always, I'm going to hit on the bullet points that I want to make sure that you're highlighting, but it is your responsibility to read the full chapter. All right, so here we go. On page 283, Introduction to a Pediatric Examination. Pediatrics is the branch of medicine that deals with the care and development of children and the diagnosis and treatment of diseases in children. A pediatrician is a physician who specializes in pediatrics. All that needs to be highlighted. We're going to go on down to where it says a pediatric office visit. Please highlight the following. There are two broad categories of pediatric patient office visits. The first is the well child visit, also termed health maintenance visit, in which the provider progressively evaluates the growth and development of the child. A patient history and physical examination are performed during each well child visit. That needs to be highlighted. If we go on down a couple sentences, the child also receives necessary immunizations during these visits. Another important component of the well child visit is a anticipatory guidance. An anticipatory guidance is a process of providing parents with information to prepare them for anticipated development events and to assist them in promoting their children's well-being. Topics that are commonly included are safety, nutrition, sleep, play, exercise, development, and discipline. All of this needs to be highlighted. Continue highlighting the following. The interval between a well child visit depends on the medical office, but as frequently follows this schedule after birth: 3 to 5 days, 1 month, 2 months, 4 months, 6 months, 9 months, 12 months, 15 months, 18 months, 24 months, 30 months, 3 years, 4 years, and once a year thereafter. A second category of pediatric patient office visits is the sick child visit. The child is exhibiting the signs and symptoms of disease, and the provider evaluates the patient's condition to arrive at a diagnosis and to prescribe treatment. During a well child and sick child visit, the medical assistant performs many of the same procedures that have been presented in the previous chapters. For example, measurement of temperature, pulse, respiration, and blood pressure, measurement of weight and height, measurement of visual and hearing acuity, and assisting with the physical examination. All of that needs to be highlighted. If we go on over to where it starts saying developing a rapport, the medical assistant must establish a rapport with the pediatric patient. If the medical assistant gains the child's trust and confidence, the child is likely to cooperate during an examination of procedure. Please highlight that. Interacting with children requires special techniques. The techniques employed depend on the age of the child. Toddlers 1 to 3 years old and preschool children 3 to 6 years old often respond well to making a game of the procedure. Explaining the purpose of an instrument, for example, the stethoscope, to a school-age child 6 to 12 years old and allowing him or her to hold the instrument or even to help during the procedure may overcome fears in that age group. Adolescents 12 to 18 years respond best by discussing the risk of the procedure and allowing them to have an input in the decision-making process. Please make sure all that is highlighted. We are going to go on over to page 286. Please come familiar with figure 9.2 and 9.3, but we are going to also start with the weight on page 286. Highlight where it says the child's weight is often used to determine nutritional needs and the proper dosage of a medication to administer to the child. That needs to be highlighted. If we go on over to the length and height, highlight where it says the recumbent length is a measurement from the vertex top of the head to the heel of the infant in a supine position. That needs to be highlighted. For the head and chest circumference, highlight the sentence where it says measurement of the head circumference is an important screening measure for microencephaly and macroencephaly. And again, I'm probably very much mispronouncing that, but that does need to be highlighted. If we go on over to page 287 under the growth charts, the very last paragraph first sentence needs to be highlighted where it states the primary use of growth charts is to look at the child's growth pattern. Make sure that is highlighted. On page 288, where it says the highlights of the childhood obesity, please make sure you do read over this, but I want you to highlight under the statistics, approximately 32% of Americans younger than age 19 are overweight or obese, which equates to 1 of every 3 children. That needs to be highlighted. If we go on down to where it says the related problems, please highlight problems associated with childhood obesity include high blood pressure, type 2 diabetes, orthopedic problems caused by increased stress on weight-bearing joints, skin disorders such as dermatitis, sleep apnea, low self-esteem, social isolation, and feelings of rejection and depression. Again, that needs to be highlighted. For the prevention, please highlight the following. Providing a health diet with 30% or fewer of the total calories consumed each day coming from fat. Encourage active play. Do not use food for reward, comfort, or bribes. Limit television, video, and computer time. Limit the amount of junk food kept in the home. Make sure all that is highlighted. And if you guys in this particular chapter, please make sure that you're reading all of the little boxes like the figures 9.2, 9.3, 9.4, the procedure 9.1 on page 288 and 289. And then if we go on over to page 290 for the procedure 9.2, I do want you to highlight the number 4 procedure step where it says read the results in centimeters or inches. That needs to be highlighted. If you look on page 292 and 293, this is what a calculating growth chart. On page 291, it kind of starts about how when you start implementing the information and as a patient continues to come in, it forms a diagram. A lot of doctors use this to determine if the patient or if the child is developing correctly, if they're underweight, overweight, if maybe they're shorter for their age or if they're taller for their age, things like that. This really helps a pediatrician. And it does continue. So we have girls on 292 and 293, and then we have boys on 294 and 295. Now, if we go on over to page 296 for the pediatric blood pressure measurement, please highlight where it states the American Academy of Pediatrics recommends that all children 3 years old and older have their blood pressure measured annually. Measuring pediatric blood pressure helps to identify children at risk for developing hypertension as adults. That needs to be highlighted. If we go down to where it says the correct cuff size, the most important criterion is obtaining an accurate pediatric blood pressure measurement is selecting the correct cuff size. If the cuff size is too small, the reading may be falsely high. If the cuff size is too large, the reading may be falsely low. That needs to be highlighted. If we go on over to the other side on page 296, the paragraph before cooperation of the child, the very first sentence needs to be highlighted. For an accurate blood pressure measurement, the bladder of the cuff should encircle 80 to 100% of the arm. That needs to be highlighted. The Table 9.3 and Figure 9.5 are going to be very good for you to review, as well as Figure 9.6. If we go on over to page 297, please highlight under the blood pressure classifications. Highlight where it says blood pressure varies depending on the age of the child and his or her height and gender. That is important, and you need to highlight that. On page 298, collection of a urine specimen, please highlight the following. A urinalysis may be performed on a pediatric patient for the following reasons: to screen for the presence of a disease as part of a general physical examination, to assist in the diagnosis of a pathologic condition, for example, a urinary tract infection, or to evaluate the effectiveness of therapy. That needs to be highlighted. Also need to make sure that on page 298, procedure 9.4, please highlight the principle under number 5. The urinary meatus and surrounding area must be cleansed to prevent contaminants such as baby powder, fecal material, and microorganisms from entering the urine specimen. And then if you look on page 299, figure 9.4, this is how they are collecting a urine specimen for an infant or a child. Now, if we go on over to page 300, under the types of needles, please highlight the following. The gauge and length of the needle used for an intramuscular injections vary depending on the consistency of the medication to be administered and the size of the child. That needs to be highlighted. I also want you to highlight where it says a needle length ranging from 5/8 inch to 1 inch is typically used to administer an intramuscular injection to a child. And in general, the gauge of the needles ranges from 22 to 25, depending on the viscosity, thickness of the medication. That needs to be highlighted. I also want you to make sure that you highlight figure 9.8. And on page 301, highlight the sentence where it says the vastus lateralis muscle site is recommended for injection of infants and young children. If we go on over to the other side on page 301, the deltoid muscle is shallow and can accommodate only a small amount of medication. In addition, repeated injections at this site are painful. Because the deltoid site is so small in an infant, the deltoid site should not be used to administer an injection until a child is at least 18 months of age, or 18 months old, I'm sorry. That needs to be highlighted. If we go on over to page 302, please review figure 9.10. But I also want you to highlight the second sentence where it says the recommended subcutaneous site for an infant younger than 12 months of age is the anterior thigh. That needs to be highlighted. If we go on down to immunizations, immunity is the resistance of the body to the effects of the harmful agents, such as pathogenic microorganisms and their toxins. The process of becoming immune or rendering an individual immune through the use of a vaccine or doxoid is known as active artificial immunization. That needs to be highlighted. If we go on over to the National Childhood Vaccine Injury Act, I want you to look at the second paragraph and highlight where it says the NCVIA requires that the appropriate and most current VIS be given to the child's parent or guardian each and every time before the child receives a dose of any immunization listed in Table 9.4. Please become familiar with Table 9.11 as well. And then if we go on over to page 304, Table 9.4, this also, I want you to, this is a continual, make sure that you review this. The DTaP and the MMR, please highlight that and review that. Table 9.5, Table 9.12, and then continuing on 306, 307, please review all of that. If we go on over to page 308, please highlight the very first part where it says the name and publication date of each VIS provided to the patient and the date the VIS was given to the patient. That's just saying what you need to use to document. Excuse me. The very next paragraph, the NCVIA also requires that the following information be documented in the patient's medical record or on a permanent office log after administration of the vaccine. The following needs to be highlighted: the date of administration of the vaccine, the manufacturer and the lot number of the vaccine, the signature and title of the health care provider who administered the vaccine, and the name and address of the medical office where the vaccine was administered. This is what needs to be documented. Now we're going to go on down to where it says the newborn screening test. Please highlight the following. A newborn screening test is performed on an infant to screen for the presence of certain metabolic and endocrine diseases. The diseases that are screened vary by state, but typically include PKU, biotinidase deficiency, congenital adrenal hyperplasia, maple sugar urine disease, congenital hypothyroidism, galactosemia, homocystinuria, and sickle cell anemia. That needs to be highlighted. And again, apologize. I'm sure some of these I'm mispronouncing. Some of these words are still 20 years later difficult to say. Now, if we go on down on the other side of page 308 in the what would be considered the, I guess, this first paragraph, please highlight where it says the following. If the accumulation is left untreated, causes mental retardation and other abnormalities. That needs to be highlighted. If we go on down to the next paragraph, the next two paragraphs, the very first sentence, please highlight where it says all states require by law that infants undergo newborn screening. The best time to perform the test is between 1 and 7 days after birth. That needs to be highlighted. If we go down to the very next paragraph, the newborn screening test card in figure 9.15 includes an information section that must be completed before the test is performed. Highlight the following. The newborn screening test is performed on capillary blood obtained by the fleshy part of the lateral or medial posterior curve of the plantar surface of an infant's heel in procedure 9.5. The blood specimen is placed on a special filter paper attached to the newborn screening test card in figure 9.15 and is mailed to an outside laboratory for analysis. The results are ready in a few days. If one of the newborn screening tests is positive, further testing is performed. I want to go on over to page 3.1, page 311 in procedure 9.5. Please highlight number 4 on the procedural step and the principle. And that concludes chapter 9. Now, chapter 9 for the pediatric examination, I know I tell you guys all the time to read the whole chapter, but especially on this one, it covers a lot of important information, you will see on a routine basis when you work with a family, a primary care provider or a pediatrician, and it's great information for you to read over and study.